Hello, I'm Dr. William Berger, owner and founder of Northeast Medical Practice. We are a concierge-style internal medicine, weight management, and aesthetics practice located in Great Neck, New York. Now, today I wanted to talk to you a little bit about exercise and physical activity. My patients in our weight management program, or patients in general, often ask me, well, of course it's good to exercise, but how much should I exercise? So of course it does depend on your physical condition, but for people who are able to exercise, the minimum that you should be shooting for is 150 minutes per week of moderate intensity exercise plus 2 strength trainings. Now, moderate intensity, what does that mean? Well, the easiest way is to do what we call the breath test. And that means you can be a little bit out of breath, but you'd still be able to hold a conversation with the person on the next treadmill, for example. Now, you can actually cut that down if you make this rather vigorous physical activity. So what does that mean? That means things like swimming, biking at least 10 miles an hour, jogging. It could even be heavy yard work, shoveling snow, things like this. Things that get your heart rate up to about 75% of its maximum. But doing those activities will put you in the right range without paying attention to your heart rate. So that can be 75 minutes per week. And you should also incorporate at least 2 strength training sessions. And for strength trainings, try to focus on big muscle groups. So perform exercises that involve many different muscles rather than just one. So for example, bicep curls are not that helpful, but deadlifting, squats, bench press, lunges, things like this that work multiple muscles in one particular movement can be really helpful. Now, of course, if you have any concerns with whether you're able to exercise, the extent to which you're able to exercise, you should, of course, consult your physician and make sure that you're cleared in that sense. But for people who are able to exercise, these are the minimum recommendations. And don't forget as well that all the movement that you do throughout the day is really important too. We call this non-exercise activity time, or NEAT. This is taking the stairs instead of the elevator, parking far away from your destination and walking in across the parking lot, even fidgeting at your desks, having a standing desk. All of these kinds of things can really add up, and if you're diligent, can burn about 500 calories per day. And remember, you may spend an hour on the treadmill and only burn about 300. So NEAT is also really important. So as long as you're able, get out there and move. It is one of the best forms of medicine that isn't a medicine. So as always, everything I recommend on these videos is for educational purposes only, and like I said, you should consult with your medical provider if you have any questions or concerns with regard to exercise or any aspect of your health, as we have not as of yet established a doctor-patient relationship. If you have questions, feel free to reach us at the office, 516-604-3418, or online, northeastmedicalpractice.com. And until we see you next time, be in good health.